Thank you, Madam Speaker. In our June session, I asked the Minister of Health about the status of the ASLI grant for the Bassano project in my constituency. I'm pleased to hear that this project was approved just a few hours ago. However, there are dozens of other communities that are still waiting on word for their projects. Will the Minister help Albertans who are waiting for answers understand which have been approved and which have not?
Thank you, Madam Speaker, for the opportunity to address this question. I really enjoy having an opportunity to talk about the great news that this government's doing. And of course, if we had elected a different government, one that was campaigning on significant cuts, that would have been very difficult. So in terms of the projects that aren't going forward, there are only 6 projects that we've decided don't meet the criteria. I've reached out to each of the individual MLAs who are impacted and their ridings that are impacted, and so if the proponent's being contacted directly. And the other 25, good news. So if you didn't hear from me, the project met the criteria. We're confident it's going to be financially viable and it's going to meet the needs of the community.
The secrecy behind this announcement is concerning. The Minister announced that of the 31 projects on the list, 25 are approved, meaning 6 are not. If they're following the Fildebrandt, maybe they can know what's going on. But the Minister seems unwilling to tell us what the criteria was. Maybe she has good reason for cutting these projects. Maybe she doesn't. Would she tell us why these projects were not approved?
Absolutely, Madam Speaker, and thank you for the question. You might notice that a lot of us are wearing orange today. It's because it's our last sitting day before Halloween, and Halloween can be a scary time of year. There are some scary things, and one of them are the proposals for significant cuts from the members opposite. In terms of the criteria that was used, we wanted to make sure that there were evidence-based decisions, that they were actually going to meet the needs of the community. So if there were actually citizens who needed to be in long-term care that were either in hospital or at home, we wanted to make sure that we're investing capital dollars and fulfilling those highest level needs first.
We've seen no evidence given today, Madam Speaker. The Newell Foundation has told me just this morning that even with the ASLI grant, the Bassano project cannot go forward until they have confirmation from the Minister that it will be integrated with the local hospital. Will the Minister commit to my constituents to integrate the Bassano project with the hospital so that we can get this critical project started now?
Thank you, Madam Speaker. We did actually call each of the individual proponents. The ministry staff did yesterday, the ones that weren't moving forward, and today the ones that were moving forward. And they're going to be having follow-up conversations. We want to invest that capital money in the highest levels of care, so long-term care and dementia beds. And they are absolutely having follow-up meetings with each of those proponents. And the individual questions asked from individual sites can be raised at that time. And within the next couple of weeks, I'd be happy to table the numbers of each of the individual sites if you'd like that.